tensions are running high in Ohio as Donald Trump and Joe Biden prepare to go head-to-head in the first presidential debate. A $5 coronavirus test that gives the result in less than half an hour. That's what the World Health Organization wants to provide for low and middle-income countries. Already 120 million of those rapid tests have been secured in what the WHO calls a major milestone in response to COVID-19. The organization's head, Tedros Adhanom Ghebreyesus, told a news conference in Geneva that new tests were vital and highly efficient.
These tests provide reliable results in approximately 15 rather than hours or days at a lower price with less sophisticated equipment. This will enable the expansion of testing, particularly in hard-to-reach areas that do not have lab facilities or enough trained health workers to carry out PCR tests.
Our Geneva correspondent Imogen Foakes told me.
These are what's known as antigen tests. They are different from the PCR tests, which a lot of us in Europe and the United States might be familiar with now, and all of the going to get tested and waiting 24 hours to get the result, which has to be discovered in a laboratory. These are much quicker. As you heard Dr. Tedros say, they are, in about 15 minutes you can get the result. Easy as a pregnancy test is what we're being told. And what is interesting about this is that just a couple of months ago, these tests were kind of just being developed, were not viewed as reliable, and were not really, countries were shying away from them. Now they're almost as reliable as the much more complicated tests, and so they're ideal, the WHO thinks, for countries, low and middle income countries, perhaps in big remote rural areas, or who don't have the fleets of trained laboratory technicians and the high-tech labs that are needed to support the analysis of hundreds of thousands of the more complicated PCR tests.
To be honest, they might sound pretty tempting to countries where PCR tests are being used, but which countries are we talking about getting this huge number of these new tests?
Well, the 120 million, I mean, actually, if you look at the amount of tests, PCR tests that are being done by wealthier countries, it's not so many. It's 120 million over 6 months. 120 million PCR tests are apparently being done around the world in a couple of weeks now by various countries. Probably many African countries. It wasn't an accident that the head of the African Centre for Disease Control was present at this announcement. Possibly some Latin American countries, but what the WHO said for now, low and middle income countries. I'm sure the WHO is hoping that they won't stop at 120 million, because what we keep being told is this virus is going to be with us for a while. We're not getting a vaccine for a while either, probably not inside 6 months at least. So testing is going to have to keep on going. Some people may need more than one test. You feel ill 1 month and then you have a negative test. A couple of months later you feel ill again. That is the thing the WHO is saying. Testing has to keep going, tracing has to keep going, isolating has to keep going, because that's the only way to really keep things under control right now.
Imogen Foakes with me from Geneva. The coronavirus crisis has put doctors and nurses around the world in a dangerous position as they fight on the front line of the pandemic. In Venezuela, almost 200 health workers have died since March. Medical staff say they've had to work without masks or gloves for weeks. Those who complain about the poor conditions are at risk of being arrested. Vladimir Hernandez spoke to some of them.
The now familiar sound from inside an intensive care ward for COVID patients. This one is inside Venezuela's crumbling state health system. The crackling sound is of a concealed camera used by a medic who wanted to show how bad things are in his hospital. The picture is beyond clear. Most toilets are out of water, so staff often can't even wash their hands. The walls are stained with dirt and the paint is peeling off. There are buckets on the floor with water in case someone needs to flush a device. And staff are struggling to get what they need, says this nurse, who who asked us not to reveal his identity for fear of government reprisals.
We spent about a month and a half without gloves to treat COVID patients or face masks. At some point, staff had had enough and decided to quit their jobs out of fear of doing their jobs. But shortly after, they were forced by the government to come back to work.
Health workers in Venezuela simply cannot voice their concerns. Ruben Duarte is also a nurse in a small hospital in western Venezuela.
Sí, nosotros acudimos muchas veces a la
We asked the authorities repeatedly for adequate PPE and nothing. So, we decided to speak out in the media. The next day, the intelligence services came looking for me at home. Ruben was arrested in front of his family and spent a whole day under question. Although he makes great efforts to say that he was treated well.
Pero fue un momento sumamente difícil para mí.
It was a very difficult moment for me and my family. We were afraid. Health workers here fear the security services and also live with the fear of dying doing their jobs. Dr. Karina Suarez from the hospital of the city of San Cristobal says she's had enough.
The staff are simply afraid of getting sick. We are within our rights to demand adequate PPE and not be persecuted for asking.
For months, health workers across Venezuela have had to buy face masks, visors and gloves out of their own pocket. Today, the country has the highest inflation in the world, and for health workers, the prices of PPE are prohibitive. A face mask can cost $1, a fortune for workers here, says Dr.